Almost every week, a new headline comes out about soaring drug costs and how we can't continue to afford them. This is all true, but what we're looking for is a bad guy. Who's the villain? Who's at fault? We're a society that likes an evil villain. Star Wars had Darth Vader. Westerns had a desperado in black clothes and a black hat. And if you weren't sure who they were, you could always tell by the ominous music that started before they entered the scene. So who's at fault in the drug cost? Who's the evil villain? Well, it's not quite that easy, but I do think I have a candidate. PBMs, pharmacy benefit managers. Now, if you're scratching your head and saying, what's a PBM? Don't worry. Most of the public doesn't know who they are and doesn't know what they do. And that's by design. They've done a wonderful job of staying under the radar and cashing their checks. So let me break it down for you. PBMs are a whole new industry that have figured out an ingenious way to inject themselves into the process of the prescription drug process and prescriptions being delivered to patients. Think about it this way. When you go to your local pharmacy to pick up your prescription, there's really three entities involved. There's the drug manufacturer, the people who actually made the drug. There's the pharmacy itself, the people who are dispensing the medication to you. And then there's the insurance company that's paying for everything. So think about that like a triangle, each point of the triangle being part of this process. What PBMs have done is they figured out an ingenious way to inject themselves right into the middle of that triangle. They've injected themselves into this process and made a way that they make money on every part of it. Here's how it works. So the PBMs decided that there was a wonderful marketplace here and a way that they could make a lot of money. The first thing they did was went to the insurance companies and said, hey, if you sign a contract with us and agree to run all of these medications through our network, we'll go to the drug manufacturers and we'll negotiate discounts for you. We'll save you money. Fantastic, thought the insurance, so they signed the contract. Then they went to the drug manufacturers and said, hey, Mr. Drug Company, you've got this wonderful drug here. It's one of many drugs that treat this illness. If you want to make sure your drug is on the formulary or preferred for my insurance company that I have a contract with, you need to give me a rebate. You need to give me a discount on the price. The drug manufacturer said, well, I have to sell my product, so they agreed. Then they went to the pharmacies themselves and said, hey, if you want to be able to dispense this drug, you need to join my network. Otherwise, these people with this insurance or this drug won't be able to be dispensed through your pharmacy. And the pharmacy said, well, I've got to dispense the drug. That's my business model. And they signed the contract. Now, I won't go into the complicated parts of how all this works. There are things like rebates and DIR fees and clawbacks and retained rebates and discounts and all that stuff. It's not important to understand the details. The point of it is that these PBMs make money every time that transaction happens. Every time money changes hands, they keep part of it. They make nothing, and they carry no risk. If drug costs go up, they make more money. If more drugs are developed and distributed, they make more money. Get the point here? It's a beautiful model. They carry no risk and make nothing, and they make exorbitant profits. Now, there's another business model like this that's been around for a number of years, but I'll get back to that in a minute. So the next question that a lot of people have is, what can't clearly be that much money? Oh, but you'd be wrong. It's billions and billions of dollars in profit. Now, the other problem with this is it's going to a whole new level. The PBMs have figured out how to take this to a whole new level. Earlier this year, CVS, which is not only a PBM with about 25% market share, but also a retail pharmacy chain, decided that the way to make this even better is to buy an insurance company, Aetna. That's right. A pharmacy distribution chain and a PBM is buying an insurance company for north of $60 billion. On the heels of that, Cigna Healthcare decided that they wanted to get in the game too, and they announced that they're going to buy Express Scripts, another large PBM with about 25% market share, for north of $60 billion. So now we have an environment where the insurance company and the PBM, and in some situations the retail pharmacy, are all the same company. What's better than that? Not only do I make money on every transaction, I make money on the financing of it, and the distribution of it, and the PBM part of it. There's capitalism at work. Significant products producing no value. I'll talk about how this happens and how it goes to a whole level in another second. The concern about all this from my perspective is twofold. One, we're taking profits out of an already overburdened system without producing value. Two, we now have incredible perverse incentives involved in all of this. Think about the fact that Cigna, for example, as well as Aetna and United, who owns their own PBM, most of their business is self-funded, so they really don't care what the total cost is. The employer based it. So as drug costs go up, not only does their profits go up, it goes up in multiple areas. So, the other business model that's been doing this for years, that's been around for a long time, that's similar to what the PBMs are doing, the mafia. It's very much like the protection racket. Think about this for a second. What the PBMs have done is they've created their own problem, a problem that didn't exist, a barrier to market. If you don't work with us, you can't sell your product. And then they created their own solution. Well, just work with us. We've got these contracts and networks. Pay us to solve a problem we created. That's no different than that famous scene where two big thugs in cheap suits walk into a small business and say, got a nice business going here. It'd be a shame if it burned down. Which was a not so subtle threat to say, if you don't pay us protection money from ourselves, we'll be the ones to burn it down. Nice, huh? Well, think about this for a minute. With the PBMs going into the business of also owning insurance companies, or insurance companies owning PBMs, that'd be a little bit like the mafia coming in, making that same threat, and then they own the fire department. So not only are you paying them to keep from having your building burned down, you have to pay them because they're the ones who can put out the fire once it happens. Nice. That's the marketplace we're dealing with. There's your villain. Now, solving the PBM problem will not solve the entire problem with drug cost. And solving drug cost problems will not solve the entire problem of healthcare cost. It just won't. But it's a pretty good start. Thank you and good day.